Thank you. I mentioned the negotiations in Geneva on the pandemic accord earlier this morning. I'd like now to turn to Jean-François Etter on tobacco, because we have one success story of multilateralism, which is the negotiation of the Tobacco Framework Convention treaty in the early 2000s. And Jean-François, the floor is yours.
Thank you. Slides, please. So thank you very much first for inviting me. Let me remind you that smoking is the second most important cause of death and disease globally. It kills over 7.5 million people every year, year after year. And it also has a huge impact on economies and companies because of loss of productivity and premature death. The response of the international community to this problem has been a treaty, an international treaty under WHO called the Framework Convention for Tobacco Control, which pushes for countries to adopt laws on taxes, on prohibiting advertising, smoke-free places, health warnings, treatment. And if you do all these 5 things, then you'll have a decrease in smoking prevalence. The FCTC has a huge effect on tobacco control in many countries. It put tobacco control on the international agenda. It also served as a model for the Paris Agreement on climate change, and also as a model for the current agreement on pandemics that is being currently negotiated. But the FCTC, as we shall see, also warns us of the risk of misguided governance, I think, and inadequate funding. This is the proportion of smokers globally over the past 25 years, and you see that it has decreased. It can be a result of the FCTC, but at the same time, tobacco use also decreased in the US or in Switzerland, 2 countries that have not ratified the FCTC. So it has also limitations. If its implementation has been slow, the national laws have not been well enforced, and of course the main threat is the interference of the tobacco industry that has always tried to block measures. It's been funded largely by philanthropies, by Bloomberg and by Gates, and this, I think, raises serious questions about the undue influence of private actors in public policies. Also, the tobacco market has changed dramatically in recent years with the constant arrival of new products in a very, very innovative sector. And I think that the response of WHO and FCTC has been, to say the least, disappointing in this field. I think the COPs, the Conference of the Parties, have failed to include many people who would have something to say about these new products and tobacco harm reduction. This is what we are talking about. Electronic cigarettes, like the yellow model, very popular among young people, snus and nicotine pouches. These are little bags that you put here in your mouth, sold by the tobacco industry as a tobacco product, although they do not contain tobacco, just nicotine. Heated tobacco products, a little cigarette that is heated rather than burned, sold mostly by the big tobacco companies. And these products are a replacement for cigarettes. This can be illustrated by the situation in Japan. Here, in blue, you have the number of cigarettes sold in Japan over the past 10 years or so. And you can see that the cigarette market in Japan decreased by half over 10 years. It's impressive. It should be celebrated as a public health success. But at the same time, this is not the result of the tobacco control policies, like taxation. It's just the replacement of cigarettes in blue with heated tobacco in orange. So one product that does not burn tobacco replaces another one that still burns tobacco. It doesn't mean that the prevalence of smoking decreased, just the cigarette market. But still, I think it's quite a remarkable illustration of the situation. This leads us to tobacco harm reduction, an approach that is aimed at minimizing the damage of tobacco smoking rather than eliminating it. Here, quitting smoking is not the only acceptable goal. It's an approach that acknowledges that the problem is combustion. It's because you burn tobacco and inhale the smoke that you get sick and die, mostly, rather than just the nicotine. And it offers safer alternative to cigarettes to people who can't quit. Like, for instance, take people with mental health. They find it very difficult to quit smoking and to stop using nicotine, and they have to get their nicotine by other means than by smoking. So this is an approach that's important for the groups in societies that find it difficult to quit, and also for countries that have high smoking prevalence, I think. Of course, it's a very controversial approach. You have strong proponents and strong opponents of this approach. Opponents think that this approach will normalize nicotine, that it acts as a gateway to smoking, that it will attract young people into smoking, that it undermines the usual tobacco control policies, or that it is just a tactic of the tobacco industry. So a fierce debate, strong opposition of the WHO and FCTC to this approach, to the point that they do not invite tobacco harm reduction scientists to the COPs, which I think limits the ability of the parties, of the countries, to make well-informed decisions. You see that in this field, a controversy like this one, where scientists disagree and there's a constant flux of new products, it makes it very difficult to find a consensus. What are the lessons learned from the FCTC for global health more generally? I would say, first, the power of multilateralism. These problems are global, and no single country can tackle them alone. The importance of basing policies on science, and the difficulty of doing this when scientists are divided. The need to protect the policies from the undue influence of the tobacco industry, and also to provide the necessary funding to avoid the influence of external funding sources, like philanthropies, for instance, that exerts, I think, an undue influence on public policies in this case. In the case of an international treaty, you need a robust governance, which the FCTC has. It's an asset. But I think it's also a liability when when the governance drives an agenda that is not shared by all the stakeholders, all the scientists in the field. I cannot emphasize enough the importance of transparency and openness. The motto of people in public health is nothing about us without us. So it's quite important to include all the stakeholders, all the civil society organizations in the debate in order to make well-informed decisions and to implement policies that are acceptable to be effective. It's quite important, I think. And also, the need to be flexible and rapid and quick to respond to these challenges that are coming upon us, like a pandemic or the new products, new tobacco products in this field. Yes, thank you very much for your attention.
Thank you very much. Thank you, Jean-François.